one.
Hi, Mrs. Smith. My name is Kinsey, and I'll be your WT nursing student today. It looks like your doctor has ordered an NG tube. And so before we get started, is that okay with you? Okay. All right. Do you mind verifying your name and date of birth? Okay, that matches. And then going ahead and looking at your nares. Is there any reason why I might not be able to use them? Any head trauma? Any recent nose surgeries? Okay. Looks like I want to go ahead and use the left nair. So we'll get started. Also, my hands are clean. I'm not touching on poor Mrs. Smith with dirty hands. I'm gonna go ahead and apply my gloves, and we're gonna measure. Oy. We're gonna measure my NG tube. Starting from the tip of the nose, behind the ear, all the way to the xiphoid process. So I'm gonna stop about 55 centimeters. Okay? And then let me get my tape. And it's also important when you're performing this skill that you have Mrs. Smith, our little patient, at a 90-degree angle. Just makes it a whole lot easier to get it started. Oh my goodness. There is my 55 mark. Okay, we're gonna make a second tape too. This one will be for the bridge of her nose. We're gonna make it look like little pants. Just gonna kind of split it and put it off to the side. Okay, and I have some lube inside this glove, and I'm gonna put it towards the end of that last little hole. That's nice and lubed up. And go ahead and go over to Mrs. Smith. And we are gonna stick into her nose. Once we make sure it's past her throat, we are gonna tilt her head down. And then I'm gonna have my friend hold a glass of water because she can't hold it herself. I mean, she could, but it's gonna be really hard. And then each time I go in, she's gonna swallow the water. Okay, swallow. Oh my goodness. Okay, maybe I'm gonna feed it in a little bit more. And then swallow, swallow. It won't feed in, but you're supposed to tuck their chin in and they're gonna swallow, and then it'll keep going. But now it's stuck. So in a normal person, it would go to the marker, but because it's a doll, it's not working the way that I was wanting it to. But at any moment, if Mrs. Smith starts to freak out, become cyanotic, start saying, hey, or not, I don't know if she could talk very well, but any sign of fear or things are not going smoothly, we're gonna stop and immediately take it out. But if this was like normal, real person, it would go all the way to this marker. We would take this tape, put it on the bridge of the nose, and then tie it around like this. There we go. That way it's good and secure. And then we would pin the end of it on the shirt. Okay. Alrighty, Mrs. Smith. Well, that is the end of the NG tube. If there are any issues, make sure you press that call light. Before we leave her room, we're gonna make sure both head rails are up. We have her in a comfortable position. We can lay her back, but not during feeding, I don't believe. We'll put the bed all the way down to the ground, make sure it's locked, call light and reach. All my 4 P's are checked off, and she should be good to go. After leaving the room, we want to monitor, or not monitor, document date, time, which nair we use. We use the left nair. we had a 14 French NG tube. It went, well, it should have gone to like 55 centimeters. She did well. It was one attempt. And we have the chest x-ray ordered because we could not access it or use it for any way until the chest x-ray says that it's in the correct area. And I think that's all for documentation, and we are good. Okay, Mrs. Smith, it's been about 3 days or so, and your doctor has put in a new order for us to take out that NG tube. So before we get started, do you mind verifying your name and date of birth? Okay, perfect. And to take this out, it'll be a whole lot easier than us putting it in. My hands are clean, but I'm gonna put on some new clean gloves. Okay. And I'm gonna get paper towel ready so I can catch the tube and then we don't get a whole bunch of gunk everywhere. All right. So I'm going to start by removing our tape. Okay. And I'll put this right over here. Alrighty. With one hand, I'm going to take out the NG tube, and the other one, I'm going to grab any gunk that's coming out. Okay, ready? 1, 2, 3. Okay, perfect. And we will make sure that this goes into a biohazard bag. We also wanted to make sure before taking out the tubing that we're disconnected from any suction as well, because that just, we need to make sure that's done first. And then after taking it out, we're gonna make sure Mrs. Smith is comfortable. We have rails up ×2, bed alarm, well, not bed alarm, oh my goodness. Bed is locked in lowest position. I guess if she needed the bed alarm, then we would put that on. And then call light and reach. And I would document that patient tolerated well. All of the fringe, the 14 fringe came out, well, 55 centimeters of it came out. The date, time, and yeah, that's it. And then my initials, of course. And that is how we take out the NG tube.